you can see, this baby has really bad plaque and tartar, periodontal disease. Therefore, we go under general anesthesia to go and get those baby clean. The first thing I do is I pre-med this baby, and then after, this is propofol, which is an induction agent, which is going to help the patient go under general anesthesia. It's to effect. We go slowly.
Feeling sleepy?
Starting to feel it. Some flush to help the propofol that is on the hub and on the catheter to move in. Good job. Good. This machine will help us control how deep we are under general anesthesia or how light we are. So this patient, apart from dental disease, has a couple of growths on its skin.
What tends to happen is that these masses can actually rupture out, and that's exactly what this tumor did. So basically we'll use the terms growth, lesion, tumor, but there's many different ways you can call these things. We'll call them lesions or growths or tumors is kind of like our standard way of speaking about these growths. These are skin tumors, so basically they have erupted on, or they have developed on the top part of the skin. And so you're able to kind of see their morphology a little bit more obviously than if the tumor was underneath the skin. Now with these, because this one has ruptured out, we worry about the infection that now has developed inside the middle of that tumor. But in general, whenever we're removing these growths, we are going to take wider margins because we don't know if they're cancerous or non-cancerous. The good news in this case is that these typically represent something called a sebaceous adenoma. So those are like going to be skin glands that got bigger and then came to the surface of the skin. Sometimes we'll keep them on the body if they're smaller and we've already identified, like let's say we took off a tumor, we sent it to the lab, they told us it was non-cancerous, and then we had another lesion that popped up that looked exactly the same. Sometimes they'll be pink, sometimes they'll be white. They can look kind of cauliflower-ish. These are a little bit larger than our typical sebaceous adenomas, therefore we are going to send them to the lab and identify if they are or are not, and if we should be removing the rest of them.
I'm going to remove these growths that are ruptured and are just being very annoying for the patient. It is very itchy, it is very painful. We did everything necessary, we did blood work, the patient is healthy, so therefore we're just going into surgery to remove those growths. Send them out for histopath to see what they actually are and to see if we need to change our treatment plan. But the best thing to do for them is just get them out of the body. So that's what we're going to do today. Using cautery is really good. It's because at the same time you are cutting, you're going to have less bleeding on the procedure. All I see is a lot of fat, so that's good. But there are some vessels, like any type of growth, there's going to be a lot of vessels, because those are going to be the ones who are going to feed the growth. Majority of the time, whenever we remove a growth, it's normally so superficial on the skin that normally the doctors do skin and that's it, and it will close fine. I like to do sub-Q to try to make my edges be the closest as possible internally, and then I do skin. It gives me double security that the incision is not going to open. Therefore, it's the way I like to do it. I like to do internally and then externally. It depends on what type of growth you remove. Sometimes definitely you need to do 2, and sometimes even more than 2, because sometimes you have growths that are attached to a muscle. So it just depends on what type of growth you remove, is how many incisions or sutures you have to do, and depends on the pattern. This one was a really simple one. It was just on the skin. I still like to oppose my edges with internal, just the way I like to do it. Not necessary, but just more secure. And also it's on the hip, so this area has a lot of mobility, therefore it's better to secure it.